The news of highly pathogenic avian influenza A, or H5N1 bird flu infecting cows and humans in the United States is now in the news as of 2024. This highly pathogenic avian influenza virus has spread in an unprecedented extent globally in recent years. Although it is easily confused with other flu-like illnesses, especially common cold, the bird flu is more severe disease caused by a different type of a virus. Hemagglutinin, represented usually by H, and neuraminidase, represented by N, are important viral proteins playing fundamental roles in replication of the influenza virus and are used for influenza virus classification with H and N is used. In this case, it is the H5N1 lineage which was initially reported in China in 1996. Since then, the virus has evolved into several subclasses. The USDA's National Veterinary Services Laboratories confirmed in March 25, 2024, the detection as H5N1 clade 2.3.4.4b, genotype B3.13, from milk samples from sick cows in 2 cattle farms, one in Kansas and another in Texas. That is the initial report of this emerging health event, especially in dairy cattle. As you can see in the USDA report published last week, H5N1 bird flu has been around affecting different species in the USA since some time, especially since year 2022. While it's uncommon for humans to get infected with H5N1 virus, being around infected animals or in places where infected birds or other animals have been can still put you at risk of getting infected. Not long time after the cases reported in cows, on April 1, 2024, a dairy farm worker in Texas was reported as the first human case in 2024 with H5N1 bird flu. No known human-to-human transmission of the virus as of today. However, people with close or prolonged, unprotected exposures to infected birds or other animals, including livestock, or to environments contaminated by infected birds or other animals, are at greater risk of infection. CDC recommends doing several precautionary actions. Number 1. If you're a farmer or veterinarian working closely with sick animals like poultry or wild birds, it's important to wear protective gear whenever you're within about 6 feet of them. This includes when handling sick or dead animals, animal waste, litter, or anything that might have the H5N1 virus on it. This means wearing a properly fitted safety goggles, disposable fluid-resistant coveralls, and disposable head cover or hair cover, disposable gloves, boots or boot covers, and a respirator like the tested N95 that we all learned about during the COVID-19 pandemic time. Number 2. Food safety measures including cooking the meats and eggs to safer temperatures. For this, the CDC's guide for the appropriate temperatures are included in the description under the video. For example, a steak should reach 145 Fahrenheit, meaning 63 Celsius, and a ground meat or sausage should reach much higher temperatures of 160 Fahrenheit or 71 centigrade. And number 3, getting tested and monitoring if exposed or have symptoms. This certainly includes quarantine ourselves if we are the ones who are having symptoms or exposed, so we can protect our family members and loved ones from catching the infection because they used the same equipment or touched the items we handled and then end up touching their nose, eyes, or mouth. With all what we learned from the COVID-19 pandemic, it is safe to say we know the drill in this case. State health departments and your local clinics are the best place to get further information and get tested. Don't forget to wear the mask if you're going to get tested. And like any other flu, it is caused by a virus. Unless recommended by a doctor to get antivirals, know that your body's immune system is capable of recovering from the virus. So on to the Onehealth side of this health event. USDA report indicates that there may be multiple risk factors leading to the spread of the virus across the states, including moving animals between states and between farms. This also indicates shared transportation vehicles that are not well cleaned when moving between farms, shared personnel like employees and visitors to farms such as visiting veterinarians, farm workers working at multiple different farms, or contract haulers or hoof trimmers. Therefore, the federal order requires mandatory testing prior to the interstate movement of lactating dairy cattle and mandatory reporting of positive influenza A test results in livestock. Laboratories and state veterinarians are required to report positive tests in livestock to USDA's the Animal Plant Health Inspection Service so the disease spread in the animal population can be tracked and control measures can be implemented. Farmers are asked to follow USDA recommendations of biosecurity for H5N1 bird flu to limit the between-farm and interstate transmission of the virus. This includes using designated delivery trucks and routes for milk, animal feed, and rendering. Use of EPA-registered disinfectants on contact surfaces, worker safety recommendations, monitoring and testing sick animals including those animals around the farm like domestic cats and wildlife, safety measures when discarding milk, and limiting cattle contact to those essential for the health and continued operation of the dairy, and provide clean clothing and footwear to those entering. The links to Biosecurity Guide and USDA support for producers with affected animals is in the video description below. As it was in the previous years where bird flu affected United States animal production, poultry and turkey farms are at risk for contracting the infection, with this time affected dairy herds also posing a risk to nearby poultry farms. As a disease that is not only affecting animals but can jump back and forth from animals to humans and from infected people back to susceptible animals, H5N1 bird flu is a prime example of a Onehealth scenario where human health, animal health, and the environmental protections comes together and needs to work collaboratively to minimize the spread through communication routes that are linking what each of these sectors are doing to play their role in the disease control and support farmers.